Well, it's great to see everyone here again. This is our Thriving Thursdays Wellness webinar at Capital Integrative Health. And today we have two very special guests and members of CAH, Dr. Hiza and Emil. Dr. Hiza is a doctor of physical therapy that has been really helping out a lot of patients here with different chronic pain conditions and many other imbalances, including bone health, and which we can talk about in a bit. And Emil Clark is a physical therapy assistant as well as a certified ergonomic specialist. And good to see you both here today,
Hey,
Hiza
good to
and
see you
Emil.
too.
And I
Thanks.
will talk with you in a very shortly. We're just going to go through a couple of brief community updates. So we have our Facebook group that some of you have joined already. Welcome to you that have, and if you haven't, please go on there and join. We'd love to see you there. We are doing a cardiometabolic nutrition group visit. That's a virtual group. That's Wednesday, July 28th from 4 to 5. Even if you've been listening to these for a while, like I have, every time I go in there, I learn more and more. So if you've seen our nutritionist, or even if you haven't, welcome to come in. Especially if you haven't, I would say come in there. But even if you have, it's really good to talk about healthy weight, healthy metabolism, and healthy nutrition in a healthy way. When I say healthy, I mean a healthy relationship with food, because we don't want food to be an antagonist to your life. We want this to be, a healthy part of your journey long term. So please join us for that. And then upcoming at CIH, I think that's just is there anything here? That's a circle. Okay. Upcoming, we have the Root Cause Revolution, which is our new podcast. It's coming in September 2021. So we're really excited about that. That's actually going to be here very soon. We're going to be starting taping on that coming up, and maybe I'll announce next time who the guests are. Unless Ben, you want me to announce now, that's fine. But we are going to have some really special guests on there, some members of CIH. I think eventually a lot of us will be on there too, as well as many nationally and internationally known guests as well. So we're really excited about that and really moving the needle on what it means to be healthy and to be well. If you have any specific ideas for the podcast, please type them out here or email us or call us or something. We want this to be a service to you, especially at CIH, but also to people that you might know that are not here at CIH yet and things like that that want to learn more about us. But it's more than only the clinic. This is also becoming a movement, a global movement, I would say, that is involved in really talking with people and investigating what the root causes of both illness and health are, and creating and being part of this revolution in health and wellness that I think we're all kind of coming to know, especially during this COVID pandemic, is that we have to take charge of our own health. We have to understand what the root causes are so that we can be empowered to take charge of our own health. So we're really excited about that, and thank you for your support. Okay, I did not create this slide, but I'll just say that I am presenting in New York along with Laura Parkins, who's our great IV head nurse here. We're going to be speaking at the Integrative Healthcare Symposium. A lot of us are going to be up there as well. Our medical team will be up there. Our nutrition team will be up there. Laura and Meg will be up there, IV nutritionists. And we're going to be in New York City. This is our first national speaking sort of opportunity. And this is to be of service to other clinicians, really. So if you're a clinician and you'd like to come up there, be up there, I think they may have a virtual option as well, but the registration is there at ihsymposium.com. It's just been really fun to do some research and to kind of understand the evidence basis, the clinical experience for IV nutrition. If any of you have done IV nutrition here, please speak up and let other people know here what your experience has been. And hopefully you've had some benefit from the IV nutrition. So we're here to be of service to other clinicians around the nation as well. During that time, we're grateful to have that opportunity. We are also partnering with Bastyr University, which is a leading naturopathic school in the Seattle, Washington area. And we're going to have a resident coming on, which I can now say is Dr. Natalie Sheeler, who is a graduate of Southwest College of Naturopathic Medicine, but she'll be starting with us in October for her residency. And she already has a couple years of experience too, but we are really excited to have her come on and join CIH in October. Okay, I think all right, so now I will hand this over to Dr. Hiza and Emil in addressing pain with physical therapy. So again, welcome Hiza and Emil to the webinar here.
Thank you. Thank you. Thank you for having us. And as always, it's always a pleasure to connect with everyone and Hi everyone out there in CIH land. I'm sure we've probably run into each other or on virtual chats or in physical. Um, if any of that applies to any of you, it's good to see you guys again. But yeah, we're going to talk about in general how we manage pain and how we look at pain from a physical therapy lens. And the first thing that I want to mention is that pain is very complex. It's a very complex process. It's a very complex thing that we don't fully understand, but we're starting to appreciate a lot more that it's not just this kind of input output, like, oh, I hurt myself, so I have pain, or I have, lasting pain because of, we know that pain can be a contributor to a lot of health maladies, and we know that over time, chronic pain itself can cause a lot of other limitations that impact your lifestyle, impact so many other aspects of your life. So what we want to take a look at today is really how pain can impact your life, but also how physical therapy can help you contextualize that pain and create a different narrative to start the healing process and start getting back that confidence. And that's really where it first starts, is confidence. How do you build the confidence around someone's ability to do? And how do you build that process that's consistent and specific for them? So a lot of times when you have pain, if it's, let's say I'm running and I trip and I fall and I hurt myself and I scrape my hand or scrape my knee, that's one type of pain. But then there are other pains that are not physical, you can't really see them, but they're very present. And so we're going to talk a little bit about the difference between the two and the similarities between the two. So the first thing is physical pain, where you get trauma, falling, straining, spraining, tearing. That is a physical trauma, and the pain response is very different. Usually there's a beginning, middle, and end, right? So it hurts like hell, you patch it up, it resolves, or it gets better, or it heals on its own, and then you get back to living. Sometimes the central nervous system can have an unusual reaction or overreaction, and that beginning, middle, and end process occurs, but the pain process remains. So the brain's perception of pain remains elevated. So you never really get rid of the pain. So some people have said, yeah, I've had low back pain for 25 years or 30 years or whatever it is, whatever that time frame has been. It's not to say that the pain isn't real. It's to suggest that the pain that you're experiencing now is not from the physical damage or the trauma that you had from the initial injury. There are a lot of central nervous system processes that take place that sometimes, again, for whatever reason, we're not entirely, we haven't been able to appreciate truly what happens. But what we do know is that there are certain things that happen, and then the brain gets kind of triggered into kind of being in this excited state the whole time, which is why some of us say, I'm sure we've all encountered, or, Emil and I have encountered lots of patients that say, oh, I don't do squats, or, oh, I don't do stairs, oh, I don't do lifts anymore, or I don't do insert whatever activity is there, because it's usually tied to the initial trauma, right? So the brain kind of builds this kind of, back pattern or kind of protective pattern there. And that pattern, or that built-in pattern, is supposed to be a very short-lived process, because it's trying to protect you from doing more, right? From doing more trauma or doing more stress or irritating those structures even further. But again, for reasons that we are not entirely sure about, sometimes that process lingers for a very long time, and it becomes kind of this chronic pain that kind of fits in. So what physical therapy does, or what we try to do here with our CIH team, is really to help our patients contextualize that experience. So looking at how does that pain affect or permeate your life, because that's the best way to address this. It's not a matter of you just need to lift or do more exercise. The first step is really, how do you help them contextualize the pain? How do you educate them on that pain? And how do you kind of walk them through that process that says, okay, well, maybe the pain that you're feeling is very present and very, very alert, but maybe it has much more to do with how you're interpreting that. So how do we create a lifestyle process or activities that you find interesting that you can do to integrate, to start to create that context again, right? Maybe you're a walker or you were a walker before, and now this pain is limiting you from doing walking or tolerating walking. So maybe the process isn't so much with physical therapy that you need to do exercises that are going to just increase your overall strength and your fitness because you haven't been doing a lot. Maybe the first step is really, how do we get the foot and ankle to move a little bit more effectively? And then how do we get you back to doing the walking part, right? So you don't have to always address everything. You can address the primary components that create that context around that. Maybe as the, over time, maybe that range of motion, they lost that mobility in the foot and ankle, and that created more tightness or more stiffness up along the chain, and that creates conformation as well. So what I'm saying is, when it comes to chronic pain, context is everything. How that person perceives that pain or rationalizes that pain means everything. You will not be able to actually address someone's needs unless you address their lifestyle goals. And so appreciating their lifestyle, appreciating where they are currently, helps you address the problem or the limitation that's specific to them, not necessarily a protocol that's specific to, hey, if you've got chronic pain for more than 5 years, protocol A, or chronic pain more than 10 years, protocol B. That doesn't work. Now with physical pain like strains and sprains, those are different. Those have a very predictive model, right? There's a beginning, middle, and end. We know that after the trauma, it takes 2 weeks for the body to kind of do its thing, another 2 weeks for it to consolidate all the structures, and another 2 weeks for everything to close up. So usually about a month or so, most of your physical injuries usually do resolve, and then over time, does your body remodels. And so in that direction, what we do is we work on, how do we gradually increase your load tolerance? How do we start to apply a little bit of stress gradually so that those structures start to go, oh, I know what we're supposed to do. We're supposed to do this, and we're supposed to feel this, but you don't want the load to be so high that it becomes noxious or it becomes a guarding response, because then you can trigger that same unhealthy healing response that we talked about earlier that can lead to chronic pain. So the idea is that you don't address the pain for, the fact that it either looks healthy or it looks unhealthy. You address the pain in terms of how it impacts that person's lifestyle. So if I can't reach to the cupboard to grab something because my shoulder hurts, there's no point in me giving you bicep curl exercises to do that. My goal is to really, how do we gradually increase that activity so that over time, the range of motion gets better, but also your confidence gets better, because the more you can do something without stirring things up, the more confidence you have. The more confidence you have, the calmer your central nervous system gets in terms of guarding, in terms of that protective response that we talked about. So chronic pain and dealing with pain, these are really addressing most of the time unhealthy responses to normal, strains and sprains and pain. Now, there are different types of pains too that can be chronic, and some of those things include, postures, right? So static postures. Now, what we are again appreciating about posture is that it's a lot more fluid and it's a lot more complex than just I have good posture or I have bad posture. Posture is a very fluid thing. We want people to have that idea about posture as well, is that just because you're sitting like this doesn't mean you're going to have back pain. Just because you sit like this doesn't mean you're going to be free of back pain, right? So the idea is that the pain is not in response to the posture, but it's in response to how healthy those tissues are able to tolerate that posture. So the longer or the more robust they are, the longer you can tolerate those positions. So
darn it, I was trying to sit up there as you were speaking.
I saw that.
You saw that?
I saw that. He was like, oh, shoot.
Yeah, let's start with lower back pain, if you don't mind. I know we have some questions here, and I think a lot of people have lower back pain. I remember when I transitioned from being a hospitalist to being a primary care doctor, and I was like going from walking or even running around the hospital trying to put out various fires to sitting in an office space. I started to get back pain, and so I'm curious about, what are the common causes of lower back pain? What can we do as people that are not expert in musculoskeletal medicine like you are and like Emil are, is that can help kind of identify what the common causes of low back pain is and are and how to address those.
Great question. So, two things. The back pain that you're describing was really in response to kind of being on the go and then coming to a complete stop, right? So that static position is asking those muscles to remain under tension for a really long time, but they're not used to that. They're used to being on the go. They're used to be bouncing around. But when you come to a complete stop, it's the muscles in your back are no different than the muscles in your bicep or quad. Or if you contract them and you hold it for a really long time, eventually they're going to fail, just like your bicep. If you hold it there for a really long time, it's going to fail and it's going to be sore and you're going to hurt. The same thing happens in your low back, but we've created this narrative that anything you feel in your back is a bad thing and that you should avoid it at all costs, or that it could lead to something more insidious. But the spine is one of the most robust structures in our bodies. It holds and maintains the shape of our bodies. It absorbs impact. It's got ligaments. It's got tendons that are just, they can tolerate, the amount of tensile force they can tolerate is so high that, the back is not as fragile as we've portrayed it to be.
So in a way, pain is a signal to say, hey, there's a mismatch between what you've been doing, what your muscles are used to, and what you're doing right now.
Correct. And sometimes it could be just training specificity too, right? So for people who exercise regularly, sitting still for a very long time it's a very noxious stimuli, because their central nervous system isn't used to that level, like you said, that mismatch between being able to contract and relax those muscles and being able to just hold those muscles for a really long time. So what you're feeling in terms of back pain or back stiffness isn't that the back itself or the structure itself being compromised. It's the muscles assuming these new length tension relationships.
All right, so there's deconditioning, but then we know that a lot of people do have metabolic syndrome or have these, kind of situations where there might be more actually anterior pressure or coming from the anterior, coming from the front of the body in terms of increased belly fat and increased pressure from anterior to posterior, which then is causing maybe degenerative joint disease and other things. So can you comment on like DJD and those type of things?
Sure. Yeah, and again, I mean, I think what we've been able to appreciate about DJD is that it's really more consistent with like an inflammatory response rather than the actual wear and tear of these structures.
Okay.
So it's not that the wear and tear of the structures is causing the pain; it's really the inflammatory response from the metabolic changes that's
now you're
causing
speaking my language, functional medicine. Everything comes
so,
back to inflammation.
Yeah, and the reason why we can say that now is we've been able to appreciate through countless studies that even if someone presents with advanced degenerative changes in their spine, they can be very asymptomatic and not have any pain. So the severity of joint changes in the back is not. You cannot draw a correlation and compare that to the severity of pain.
I want to bring in, and maybe Jen can comment on this as well, but I remember when I was doing more straight primary care at Hopkins, and I saw this patient who was 80 years old, 80-year-old guy, and had arthritis everywhere, including DJD. Of course, and then I asked him to stop eating sugar. He was doing Coke and bread and all these different things. After 30 days, all of his arthritis went away. I mean, I think that's a very extreme, amazing case of like someone, but what you just said makes a lot of sense. If someone has arthritis in their hands or their feet or anywhere like that, or in the back into the DJD, like you said, the spine is very robust. There's stem cells being generated all the time in the spine. So why is that person having pain if it's not musculoskeletal? If it's more spinal, is it really inflammation that's going on? And this individual that was 80 years old at the time literally stopped eating sugar for 30 days, and the back pain went away, which you wouldn't expect that even from the medications he was taking, and NSAIDs.
And that's and that's a good point, and that's kind of the next segue is that the context around that process is really important, right? So how we explain that to our patients, how we articulate to that patient, how we calm them down with education rather than just adding on more anxiety or more fear about what could happen. That's also part of the healing process as well, because that gives them that license that, oh, well, maybe I'm not that banged up. Maybe I'm not that hurt. Maybe I'm not that compromised. Maybe I am a lot more robust and I can start to do more. But we've created this narrative on so many platforms and so many levels that if you've got back pain, this is the beginning of the end and that's it. And you know, this is a slippery slope. But before we get going, I wanted to introduce Emil, who's a physical therapy assistant, who can talk a little bit more about kind of the postural changes that happen at your workstation and how does that kind of play into context and how do we create a different narrative there too, so that the idea is not necessarily can I sit up tall or can I sit down, but what can I do about my work environment to minimize a lot of these aches and pains that we normally experience.
And when we say work for our listeners here, we might be talking about someone that has a job or someone that's at home at their workstation, even if they're retired, that's still a workstation, correct?
Correct. Yes.
Right?
Yes.
Okay.
So a desk, anything that any place where you spend, and what I mean by workstation, to clarify, is it could be your desk. Some people work on a couch. Some people work on a chair. Some people work wherever that may be. What Emil is going to discuss is really what do those different positions, what are the impacts of those different positions, and what are some things that can cause or can contribute to episodes of low back pain or shoulder strains. Go ahead, take it away, Emil.
Awesome. Thanks so much, Dr. Hiza. So first of all, I think it's so interesting what you just said, Andy, as far as how much sugar causes inflammation. I think it's interesting how almost all sports teams, like their main nutritionists they take out sugar from the diet of all their top athletes, like LeBron James, Tom Brady. None of them eat any sugar at all. So I thought that's pretty interesting. And so that's something I've been working on, cutting sugar out of my diet because I have a sweet tooth. So that's something I'm working on. But so segue back to the whole posture thing. I think posture and making sure that environment, it's so important. So a lot of my experience outside of the clinical environment, like you just said, has been in ergonomics. So primarily like workstation, working in the office, but then also working in healthcare as well. So like working with nurses, ultrasound people who are kind of bad body mechanics when they're doing ultrasound, also vehicles. So if you're people who drive a lot, if you don't have that set up. So there's a deep science to how you want to set up a lot of your workstation. I know in the previous, on our previous wellness thing, I went through some slides and did a whole presentation on it. So rather than going back and going through the whole presentation, just going to touch on some of the most common things that I've noticed. So over this past years, with everyone transitioning home, from being in the office to just working at home, a lot of us are just using a laptop, right? So I've seen a lot of issues with that. People are just hunched over on a laptop looking down. And people don't realize how much that can affect your posture, right? It's literally impossible to have good posture if you're just working from a laptop. So for those of us who are now kind of working remote, just using a laptop, I think it's really important again to raise that laptop to eye level, get a separate keyboard and a mouse. Again, the whole presentation on that and the mechanics of it, why it's so bad, is in that previous post. But that's a big one. What specifically got me into this field is I would work on people in the clinic. They feel amazing, right? They feel great. And then they're going back to these poor work environments. So and then the next day they're coming back into the clinic and a lot of this discomfort is coming right back. So I'm like, what is it? It has to be something that they're doing. Maybe it's their bed. Maybe it's too firm, or maybe it's the workstation. Maybe they're looking up too much or looking down too much at the laptop. Maybe they're on the phone a lot and cradling the phone here as opposed to getting an earpiece. Maybe is your positioning where you're positioning your phone, as opposed to if you're answering the phone a lot, instead of just keeping it close, maybe you're reaching for the phone, right? So where you position the items on your desk, that makes a big difference. The height of your chair, if your chair is too high and your feet are floating, so for those petite people out there, if your feet are floating, which is something that seems simple, but a lot of people are sitting and their feet are floating when they're sitting, that's bad for you. That can cause a lot of contribute to the back discomfort because the ground gives you support. So there's all these little things that we just don't pay attention to, and just we don't know to look out for in our environment that we really got to pay attention to, because they can really affect your posture. So that's just a couple of different things, and definitely, like you said, Dr. Hiza, stress can play a major factor. And just again, increasing that inflammation and getting us out of that fight or flight state that a lot of times we sit in, that we're living in, and kind of calm down that, and just like doing different breathing exercises, things like that can get us out of that fight or flight state and get us into more parasympathetic, right? Get it out of that tenseness that we always have.
Just can we do you mind if we do some practical exercises? I know a lot of us are sitting or standing right now at our workstations.
Absolutely.
Even the listeners, a lot of times we're probably like mostly on online sitting. So what could we do kind of right now if someone has back pain, neck pain, and certainly we want people to be careful and listen to your body and don't like overdo stuff. But anything that what do you think we could kind of do that would be a practical kind of exercises here?
Perfect. One of the best ones, the first ones that I have, anyone who's desk bound, who works at a desk a lot, if you think about it, right, you're going to be here, you're going to a lot of times be rounded, those pecs are going to get tight, you're going to have that forehead posture. So literally do the opposite. Stretch out your chest muscles so like you can just stand up. Doing this one here, pulling your arms back, right? Getting a good stretch across your chest. Yep, like that's going to be a good one for you. Yep, just holding that back. I like to hold my stretches for 30 seconds to a minute, really getting that good stretch. You can even intensify that even more by going into a doorway, stepping into it, right? And getting that good stretch in your chest. That's going to be a really, really good one. One of my favorite stretches is child pose. So for those who do yoga, that's a really good one to open up your chest as well. If you're seated right now at your desk, another one, you can put your hands behind your head and do a nice thoracic extension. Like, oh, that feels amazing. All right. So, because again, if you're so rounded, we're so tight and rounded a lot of times in that thoracic spine. Yep. So extending backwards. So that can be really, really good to stretch that out. There's a whole lot of different ones. I really like chin tucks again. So if you really think about it, it's not like brain surgery. So if you're here a lot, you want to do chin tucks, right? So get that ears above your shoulders, right? Holding that there. That's another really good one for posture. So there's a whole host of different postural exercises that you want to do. Just because we're sitting so much, I definitely over this past year, since everyone started working remote, I've seen a lot more issues just because, again, I've seen a lot of high school kids I've been doing a lot of work with because they're working from their bed and their laptop and just looking down at the laptop, and they're going from being able to move and being in class to just sitting down in bed all day looking down at a laptop. And again,
I love that. I say a little joke here, but it's not brain surgery, but it's so good for your brain, right? Because actually our heads, if you think about the weight of the skull and the brain, it's about 12 to 13 pounds. So if we ever went bowling, right, you're having that 12-pound bowling ball. Literally, that's on your head. So any of those postures, if we're doing cervical forward flexion or if we're rounding our pecs and all that, really we're really probably leading to some chronic degeneration of the spine and of the muscles if we're doing that all the time. So having these compensatory exercises like this is really good for the brain. And I noticed there's more blood flow too, right? I mean, we talk a lot about in functional medicine about the HPA axis, which is the hypothalamus, pituitary, adrenals. And one of the things I've learned from some hormone experts that we'll interview in a couple of weeks here is that when you do things like massage, you do things like physical therapy, do things like myofascial, what's going to happen is you're going to increase that blood flow to the brain. So all these exercises, I want people to the listeners like that were on here and just start to think about this not only as like an exercise when you're stretching and of course you're preventing pain and addressing chronic pain, but you're also increasing blood flow to these areas of the brain, which is then getting your brain and adrenals online, which is going to help your entire health. So thank you for that.
You're welcome. Yeah. So that kind of adding on to you said, Andy, too. So if you have a forehead posture, right, and then and you're here, gravity is acting upon you. You have that bowling ball. It's trying to pull you down. So what's happening, right? All these muscles in your back. So if you were to relax all your muscles, you would just fall forward, right? Mm-hmm. So like all these muscles between your scapula, your neck, and back are constantly working because if they weren't working, you would do this. So you're holding, like Dr. Heiser just said, that constant contraction in your neck and back. And those muscles can get tired, they can fatigue, right? It could possibly contribute to strain and so forth. So yeah, I mean, it is important that we're being mindful of our posture and making sure that that we have our chair adjusted correctly, that we have a properly fitting office chair. And that if you are in an office chair, lock your chair back. That's another good one. So, right, a lot of us who have our chairs unlocked, As soon as you relax, your chair is going to go back, right? So then you're not getting that support. So your neck and your back have to do a lot more work after so many hours. And again, that can cause fatigue. So it's all these little things. We don't think about it, but the frequency and the duration, right? Little things can add up, right? You're kind of chipping away at that iceberg. So little small things, because of the frequency of how much we're doing it and the duration of how long we're doing it, can add a lot to our discomfort again. So definitely it's like taking that holistic approach, of course, increasing our movement. And then also, again, looking at the things in our environment. Are we lifting our kids incorrectly at home if we have the young ones, right? All these little environmental things that we're doing could be definitely contributing. And one last point, I know, and this is just for myself, like I noticed there was a particular, like every time I get up from my chair, I have a couch that's pretty low. And like my back would hurt. And then I stopped and I really looked at the height of this chair. This couch. And I realized like every time I sit, like my hips go below the height of my knees. So the couch is really low to the ground. And that's one of the big ergonomic principles. When you sit, your hips should never be lower than your knees. Ideally, you want your knees and hips at around 90 degrees. So if you're sitting and your hips are lower than your knees, again, that's gonna put a lot more pressure on your lower back, right? It's gonna essentially, it's hard to keep that S-shaped curve in your back, and it's gonna almost like collapse on itself. I think I touched on it when I did the ergonomic presentation before. So it's important. And so I changed that couch and I started sitting, and I got one that was a little bit higher up. Back pain went away.
Wow. Yeah.
So back pain went away when I was sitting on that chair. Another thing is changing our mattress. So if our mattress isn't a good fit, maybe it's not firm enough, that can cause issues. So that's another thing that I've seen people have back pain, and they think that they need surgery and all these different things, but they change the mattress and the pain is gone. So it's all these things that to also look into, in addition to also making sure we're increasing the movement, keeping our stress down. All these things can really, I think, also contribute to getting our chronic pain down.
Mm-hmm.
Great.
I agree with you. I think that's such an important thing to remember and kind of tie everything in together, is that pain is a lot more complex than just I sit at a desk and I have pain, or I sit on a little chair. Like you said, I think the complexity of it is really kind of what makes CIA such a unique place to be, because, just like we complain, or just like we mentioned that, we're not big fans of doctors always prescribing medication first. We also need to be mindful that we shouldn't be the ones prescribing only movement first, right? We can look at all these different avenues and try all these different approaches, working on controlling your stress, your anxiety, working on increasing overall exposure to outdoors, as being outside. Physical therapy it's an important part of this process, but it isn't the only process, and movement isn't the only process. It's part of this kind of big tapestry, if you think about it, that creates a more healthy and more productive person. So I hope that's been I hope we kind of explained that, and we kind of project that. But physical therapy, performance, movement patterns, etc. These are huge. We know that they have a huge impact in a lot of other aspects of our lives. But I think working on your stress level, that's a huge part. That some exercises, to a higher dose, is very effective in terms of managing that. But there are also professionals who can actually give you much more. Some coaches, some health coaching, all those things to kind of help prioritize, your life, so that you can minimize those stressors. Because we have to appreciate that this is a lot bigger than just I don't sit properly, or that I've always had this pain. There are a lot of things that we don't know what we don't know, like Dr. Wong says, that we just don't know what we don't know. And sometimes we don't know that we're in an unhealthy pattern of stress and anxiety, because we are so used to working 80 hours, and now we're sitting at a desk and we're working 80 hours. And then, you have a physical therapist saying, oh, you just need to move more. But the context around that is much more important. So how do we express that, and how do we create that context around the pain, so that the person is actually more educated on what are potential triggers, what are potential stressors, what are potential ways to create more pain, and what are potential ways to reduce that pain. So
yeah, and I think the timing, as Dr. Heasy said and Emil said too, the timing, the duration, frequency, intensity of movement, and the context around it, the attitude around movement also the mindset around movement is really important. The nutrition too, like all of this plays a role, right? Having the amino acids, having the different fats that are really important to support the mitochondria so the muscles can move in a very healthy way so that we don't get what's called mitochondrial uncoupling, which would basically be an overstress on the mitochondria, so that would prevent injury essentially. So I think all of that's really important. Marcella has a great question here. Does Emil have recommendations for good workstation add-ons for laptops?
Excellent. Yes. So you can look on Amazon and just get a laptop stand, right? And so if you can get something that's adjustable height, so I'd search for adjustable height laptop stands, right? And the goal is to just raise the laptop, the screen to eye level, right? So you want to sit up straight and raise the screen to eye level. Ideally, when you're seated, your eyes should be leveled with the upper 1/3 of the screen. So if you're seated, your eyes leveled with the upper 1/3 when you're looking straight forward. That's like kind of what the research says is the ideal height for your screen. If it's too high or too low, then obviously your neck goes from being non-neutral it just goes to a non-neutral position. So your eyes level with the upper 1/3, and there's a little bit of a trick too. So if you wear bifocals or progressive lenses, your laptop is going to be a little bit lower, right? And that's because the lower half of your lens, if you wear bifocals or progressive, is for reading, right? So a lot of times, a common thing that I've seen when I do office assessments is people who wear bifocals and progressive, they're doing this a lot. So if you ever look at like someone and they're doing this, I can almost guarantee they have progressive or bifocals lenses. And so that's the most common thing. Like I'll do, like when I'm doing my assessments, people say, hey, like, Emil, for some reason, my neck hurts at the end of the day and I don't know why. And I'm looking at them doing this right here. And so literally, all we have to do is lower their laptop screen a little bit lower. And then within like a week or two, their neck pain is significantly decreased. So anyway, so you just want to try to keep your head neutral and make sure you can still view the screen. So Marcella, you would want to get a laptop stand and then use a separate keyboard and a separate mouse. Okay, so you're not going to use the laptop on the keyboard on the laptop. Get a separate keyboard and mouse. Yep, and then put the keyboard and the mouse on your desk surface, and then raise the laptop screen to eye level. Now, if you just want to like open your laptop for like an hour, right, and while you're in bed and do some work, that's not a huge deal, right? So risk goes up with frequency and duration, because that's what people always ask, like, how bad is that really, right? So if you just open your laptop for a second, it's not a huge deal. But if you don't want to work 8 hours a day from just a laptop, I can't stress how important that is. Because that's one of the most common mistakes that I've seen people make. So get a separate keyboard, separate mouse, put that on your desk surface, raise the screen to eye level. You can even put the laptop on a shoebox. So anything to elevate it to eye level, and then getting a separate keyboard and a separate mouse. And another point is just increasing that movement. If you can get up and move every 30, 45 minutes, this is another really good gem. As human beings, right, our bodies aren't made to sit for so many hours, right, as we're sitting. We've never actually, since the beginning of time, set as sedentary as we are. This is like the most sedentary time in history, right? A lot of us have like desk jobs and computers and so forth. And then especially now with the pandemic, it's even worse, because a lot of us are moving remotely. You might get up and move to like your living room and go downstairs, and that's all the movement we're having for the day. We're supposed to get 10,000 steps a day. I saw a study that says that people who are working remotely, which is a vast majority of Americans, are getting less than 2,000 steps a day. 2,000. So that's like 1/5 almost every day, which and you can imagine that adds up. So I like anytime I do my ergonomic evaluations, I really encourage people, especially if you're working remotely, to get a step counter, to monitor your steps, monitor your movement, right? That's going to do a couple of different things. One, it'll remind you to get up and move every 30 or 45 minutes. So don't just ignore it, actually move. And then the other thing, you're going to be mindful of how few steps you're getting. So if it comes, it's like 8 o'clock comes and you realize, wow, I only got 1,500 steps, you might want to go outside for a walk, right? So two benefits of that, again, so you're going to get that reminder to move more. And then also it'll monitor how much you're moving throughout the workday. If you don't have a smartwatch, there's apps you can get called Break Reminder. You get on Android or Apple, and then just search for Break Reminder, and then you can, there's different apps in there, download one, and most of them are free, and then just set it to alert you, say every 30, 45 minutes. Even if you just get it for like a minute or two, march in place. You can do some squats. You can just walk a little bit. Just do something to kind of get that blood flowing, get that circulation going, keep your metabolism going. Then you go right back to work. There's a lot of studies on productivity that show that like we do better in bursts of work. We do a burst of work for like 30, 45 minutes. We take a short break, kind of get that blood, move a little bit, stretch, get some circulation, and then go do another burst of work for an hour. So like, so you want to keep working on it. Take a burst of work, take a short break, do a burst of work, do a short break, do a burst of work, as opposed to just working for 3, 4, 5 hours, because you're probably going to end up like, your productivity is probably going to end up leveling out, because you're going to start to get foggy and so forth, and start to make probably stupid mistakes at that point, because that you know you wouldn't normally make.
Just to echo what Neil and Andrew are saying. Yeah, thank you for that question. We were made to move, and one of the things is that as organisms, as human beings, we are made to move, and even the physical aspect of moving is sending a message to our brains that's saying that we're alive and to keep being alive. So it's sending this life signal to us actually when we're moving. So even if we're at a desk job, or we're at a job where we're sedentary, we do want to have these frequent 30, 45-minute breaks, like Emil was saying, to kind of get up, stretch, work on the pecs, work on the neck, the back, because these are things that you're gonna want to do to signal to your body that you're still alive, actually. And then the other thing that I thought was interesting is having this conversation, I think, with someone about this, is that when we have various postures, it also influences the neurotransmitters and the mood. So if we're looking up and we're looking at the sky and, kind of like looking up, if we want to elevate our mood, we have to elevate our gaze too. If we want to, if we're looking down all the time at our cell phone or laptop and the ergonomics are not right, which that's why I need a meal here to help correct that, I believe, then we're going to get more depressed. We're going to get sadder. Like the mood is actually affected by the posture. So like if I do this, and I know that we've kind of talked about this in various webinars, but you can actually influence your mood by your posture too. So it's like the positive thoughts, it's the belief systems, things like that, but also the posture would also help you make those neurotransmitters keep your body knowing that you're alive, but also give you a more positive mood. So that's a great antidepressant, actually.
Yeah.
Way to do things.
Yeah, and I think that's where, I think that's where the benefits of physical therapy are in respect to chronic pain and injuries, and is that helping someone contextualize what we just talked about is the first step. It doesn't matter how good our exercises are if they don't have an appreciation of how this is an important part of their lifestyle, rather than this is just for PT 2 times a week for 3 to 4 weeks, and then I'll move on and go by my. It's not very effective. So our goal here is really, how do we create a mind shift in appreciating the fact that movement is key, is essential, but also it's a great way to remind yourself that you are a lot more capable, you are a lot more robust, you're a lot healthier than you probably feel. And so that's kind of the job of PT and all these other colleagues that we work with, is that how do we nudge you to finding those solutions that work for you, that are specific for you, and getting to know someone and connecting with someone and really appreciating where they're coming from and where they want to go. That gives you the best way to address that.
Thank you. And I have one question about that in a second, but first, Tony is saying that I sometimes do the Wonder Woman pose when I'm standing to boost my energy and mood. Tony, can you get on video here and demonstrate that?
Yeah, let's have you get out there, Tony. Come on.
Now I want to know what that is. Yeah, Wonder Woman, Superman, whatever it is, jumping jacks, anything. But the Wonder Woman pose. Maybe Hiza, do you want to demonstrate this? I don't know.
No, I don't think I would. I don't think I would do it justice. I don't think I would do it justice.
Standing. What? Okay, so standing.
Wait, sorry, Emil. We gotta do that again. I missed that.
Oh man, I think it's just you're just standing up tall with your chest open, like.
Oh yeah, with the hips. Yeah. Okay, right.
Well, opening up your chest, open up.
I don't know. I'm pretty sure Tony could do it better. I'm sorry.
Yeah, I believe it.
I'm not gonna lie to you.
Also in yoga, there's Warrior One. I love this pose. It really boosts my mood. Just looking up at the sky, right? Doing Warrior One. Great
So
pose.
I do a modified version of that, and
Mhm.
I will. So if I'm at my workstation, one of the things I'll do is I'll just do a lift off,
Yeah.
so that I force the muscles to contract. So
Mm.
instead of turning my body, I'm just working on lifting and lifting my arm up. So those posture muscles in between my shoulder blade have to contract and
Mhm.
press rather than trying to reach like this, because that's going to be more trunk rotation. But I want to get more of those muscles that put us here. I want them to actively hold you down and back. So instead of always having to remind yourself and catching yourself, my theory is why not strengthen those muscles that do that and
Mm.
having them do that. So it's a
Yeah.
lot easier to actually go through that pattern. So if you
Mhm.
start from the bottom and you lift up, not behind you, you want to lift up towards the ceiling. Yep, just like that, you'll start to feel those muscles in between the shoulder blade do all of the work. So it's a great way to feel those same muscles that Emil was talking about in terms of alleviating them. So one thing is to alleviate the stressor, but the other part is to strengthen those same muscles so that they can have more robustness, they can have more endurance. So throughout the day, so like Emil recommends, every 30, 45 minutes, I just found myself just kind of going through those patterns or rotating out and really squeezing my shoulder blades together. So elbows are down, elbows stay down, and you're just rotating out and you pinch your shoulder blades together.
My,
And as
my
you do
back feels
that,
better already. This is great.
yeah, you're gonna feel the stretch here and you're gonna feel
Yeah.
a shortening of all those muscles back there. So I think both ways are thanks, Kathleen.
Kathleen says I'm a lot more like Wonder Woman after working with Giza. Yes.
Funny.
Yeah.
But yeah, so I think things like Emil recommends about the stretches is good, but we also want to remember that we want to reinforce that with the strengthening part. So again, leading into that mitochondria
Yeah.
mindset is that those muscles need the contraction relaxation as well, so that you can keep building up the
Mhm.
efficacy and the efficiency of those structures, so they can
Stretching,
endure.
strengthening, right? Building the mitochondria, ergonomics, getting the nutrients in. Really love this webinar. Thank you, Giza and Emil, so much. Now,
Thank
how do
you.
you work in an integrative team here at CIH? And maybe you could talk a little bit more about what Emil is going to be offering here, or has already been started to do.
Yeah. So what we're doing now is we're really working. So Emil and I work together with all our patients. So every patient that I evaluate has access to working with Emil. His job is really to kind of be my second set of hands, eyes, ears, and just kind of create that context and create that fitness context behind it. So movement patterns, improving your movements, improving your endurance, improving your efficiency. Emil is my go-to guy. So if you're trying to schedule an appointment with me and you can't, Emil is your person. He needs to be part of this process, and he's poised, he's ready to go, and I've worked with Emil for almost a decade now. So we've worked together for a really long time. So he knows what I know, and he knows what I would recommend. And so if he sees anything that looks unusual, he's going to remind you, but also he'll update me too. So we work together hand in hand. He does see all my CIH patients as well. So
Yeah, it's been fun. I think that's why I think we work so well together. Is that we have such similar perspectives just on like healing and the importance of lifestyle fitness, right? So I think a lot of people it's important to look at exercise and movement as far as the lifestyle benefits, right? By increasing your movement, moving more, moving correctly, these things are things that's gonna generally get the best out of your body, right? You only get one body. We have to be good to it, right? So you wanna keep your Mercedes Benz oiled, right? You wanna get those regular tune-ups, right? So that it can last you through that cross country trip, right? So I love metaphors, right? So your body's a Mercedes, right? You want to be good to it, right? So that it can just be there for you and keep you strong, so that you can be around for your family and be able to play without pain, play with your kids and pick up your grandkids and be around for a long time. Decrease your risk of a lot of these chronic illnesses, right? Like I always say that we're all gonna get older one day, right? But how do we I don't want to say old dirt in the relations, right? But how do we push back getting older as far back as we can, right? How do we push that? How do we keep your body feeling younger than it actually is? How do we keep your body feeling 5, 10 years younger than it has to be, right? And a lot of it just has to be by just moving more, doing, and not just being so sedentary. I can't stress how bad just being sedentary is. This past year, man, with the pandemic and everybody being so sedentary, there's been a lot of increases. There's a big reason why a lot of these aches and pains that we never really had before, we're getting these just because we're just sitting in the house, not getting enough vitamin D, not moving, not getting sunlight. All these different things that they play a factor. So yeah, man, we just got to move more. But it's been fun. I'm excited to meet you guys and hopefully help you to feel better.
Thank you so much, Phil. Thank you so much, Dr. Giza. Thank you all for participating in this and attending today, and look forward to seeing you soon. And if you'd like to book with Dr. Giza and Emil, then you know where to go. And call us and email us and everything. Be happy to see you. And I know a lot of people that have chronic pain in our practice too, and there is still hope. I mean, there's a lot of things you can do, right? So I mean, even someone that has chronic pain, you can prevent pain, but you can also help to reduce pain and even reverse some of these conditions.
Mm-hmm. I agree. Thank you again for having us.
Thanks so much.
All right. Talk to you all later. See you later.
See you guys.